And I just wanted to make the comment about the fact that Hawaii also is unique in it's a state of small businesses. There's only 2 or 3 companies in the state that have more than 5,000 employees. And so when you talk about Medicare payment reform, well, as long as the government doesn't pay its fair share of costs, that's a cost shift to our small businesses. And in Hawaii, we do require, if we're going to mandate employers to provide coverage, they cannot afford to pay for the shortfall from the government payers. It's an unfair burden on them. So I just wanted to emphasize that. We certainly do support the Medicare payment reform towards primary care and prevention and towards coordinated care, paying for accountable care organizations. So thank you very much for your time.
We also have a per capita enormous number of veterans here, and there's an issue where we need to make sure that we don't necessarily differentiate between the VA and the health care bill, or whether we combine them in some meaningful way. And I thought there was why don't we just go into that real quick?
Sure. My name is Pat Blanchette, and I run the medical school's faculty practice plan to help the school fulfill its community service mission and caring for the underserved and bringing in underrepresented specialties as well. One issue that's come up is the fact that we have a lot of military retirees in Hawaii. There's about 10% of the state is veterans, about 20% of the men. And what's happened is, to remain TRICARE eligible, when they become Medicare eligible, they have to start paying for Plan B. And that's the minimum they can pay on a graduated scale is $96.40 a month. For people who've been promised free health care all of their lives, and who many of them don't have a lot of money in a high cost of living state, that $96.40 a month, or almost $200 a month for a married couple, presents a significant burden. And I'm wondering if that could be looked at in this health insurance reform, so that the person doesn't have to make a choice between Plan B or going underinsured, or buying groceries next month.
Yeah, obviously that has to be dealt with in the context that I know Secretary Shinseki is looking at these issues, and I realize that the health care reform can't be a catch-all for everything, but we think it needs to be looked at complementarily.